to the cloud.
So that we can put it out
Yep.
later.
We just got the notice it's being recorded.
Okay. Yes, but Barbara just briefly helped me. Okay, so today we, first of all, I want to say thanks because this is a nice turnout. So we appreciate all you guys showing up. And we called this a COVID-19 update, but I'd kind of like to change the name of it to Health in the Time of COVID, because we want it to be more positive and talk about all the good things we can do so we can get through this. So I want to just say that to me, health is not just not having an infection. Health is being strong, it's having fun, it's enjoying your people, your family, and your friends, and it's feeling in control. And that's a big part of what we want to help people do, because some people feel out of control. So we're going to cover a few things. We're going to talk about preventing this infection, preventing complications if you get the infection, testing, how to treat it if you get it, life after having the infection, and more importantly, how do we prevent future pandemics? So Dr. Mansfield and I are going to kind of go back and forth. So first, I just want to say a word about prior pandemics. So this is not the first one we know about. The big one that's kind of in the news these days is the 1918 pandemic. So that was 102 years ago, and at least 50 million people died in that pandemic. Then 39 years later, in 1957, there was another one. It was H2N2 virus, and it killed about 1.1 million people. 11 years later, there was another one, H3N3, and that killed about 1 million people. And then now, 51 years later, we have COVID-19. And I gave a talk kind of like this one on June the 3rd. And on that day, I said, COVID-19 has killed 290,000 people. But now the number is something like 714,000 people. So we have survived worse in the past. And this is not a new thing to the world. So we're going to talk at the end about how to keep this from happening again. But now Dr. Mansfield will just tell some stats about COVID-19.
Yeah, so just, and probably, I don't know, most of you are aware, but May, when you mentioned that 50 million people passed from, the 1918 epidemic. So current stats, so cases around the world were at about 19 million. The US cases were at about 5 million. And then in Arizona alone, it's about 182,000-ish, and these are of cases. And then for deaths or passings, so worldwide, 711,000, I think you said 714, maybe that's the difference between last night and today.
Yeah.
And so in Arizona, we're just under about 4,000. So those are kind of the current numbers and the current statistics.
So the first thing we want to talk about is prevention. And I want to talk for a second about why this disease is bad. One of the biggest problems with this infection is that it causes really intense inflammation, and the inflammation leads to clots, which cause blockages, and so they cause strokes, heart attacks, kidney problems, and it's all related to too much inflammation. But I want to make clear that inflammation is not bad or good. So you want inflammation. It's how your body deals with invading germs or chemicals or whatever. You make inflammation and you fight the invader. So if I go outside and I get a bug bite, I will make inflammatory chemicals that will get rid of whatever's irritating my skin. That's good. If, however, I have bad allergies and I go out for a walk and every time I smell pollen, I start sneezing and wheezing, that's a little too much inflammation. If I have so much inflammation that my body attacks itself and my joints, that's really out of control, and that's diseases like rheumatoid arthritis. So inflammation can be good, not so good, horrible. So we don't want to make our inflammation go away. We need it to fight the virus, but we don't want it to go nuts when we get an infection. So there's a delicate balance, and there are several things that we can do that affect that balance. And they are all not just theoretical, there's really good research on each one. So the first one I'm going to talk about is fitness. So share screen, and then where did my things go?
I think you switched tabs.
So how do I find them?
Is it okay if you go to that browser?
Yeah, that's okay, right here.
Yeah, just do it.
Go to the browser and then pick my presentation. Good
That's the
thing.
first slide.
But I just want to show only the slide, so present.
Mhm.
Yay. Thank you. Don't go away, I might need you for a minute. All right, so fitness is the first one I want to talk about. And the reason that exercise matters is because it helps prevent cardiovascular disease. And COVID kills not just by making people short of breath, it kills by causing cardiovascular disease. It causes clots. So when you exercise daily, you keep your arteries open and you prevent clots. And you have, if you do this daily, you way reduce your chance of complications if you get the infection. So that's empowering. I might get it, but I might be able to deal with it better. I put this slide up because exercise is harder to do right now because the gyms are closed and it's 150 degrees outside. So this is an example of 1 bazillion videos on YouTube for workouts. I put yoga in particular up there because you want to try and get 4 types of exercise, not every single day, but rotate. You want flexibility, balance, strength, and cardio. So yoga gets the first 3 of those things. So that's why I put that up there. The next,
Your presentation is not showing.
Yeah, we can't see the slides.
what do I do, Sammy? Let's see, and that's not the right one.
Oh, I guess you didn't share screen.
Go back.
There it is.
How about now?
There it is.
Okay.
Perfect.
So,
Click share.
okay, so now I can just click and it'll just go to the next one. Okay, good thing you didn't leave. Okay, so that's an example of how you can go on YouTube and there is every possible kind of workout on the planet. This is yoga. You can look up Tai Chi. You can look up weightlifting. It's all there. So that's fitness. The next thing that I want to talk about is nutrition. So on the topic of nutrition, so there are many foods that cause you to make better immune responses. And I have a short list of foods that make you produce IgA, that's the immune globulin that you make when you first get an infection, and it makes your mucus more effective at keeping out invaders. And that's the mucus in your eyes, your nose, your mouth, your gut. So some of those foods, mushrooms, raw garlic, flaxseed, gooseberries. But first of all, everyone doesn't like all those foods. And secondly, you don't want to focus only on a few foods. You want to have a wide variety because there are so many micronutrients that we don't know about. So you can't just eat broccoli. I'm picking on one of our people in our office who's not at the meeting right now. But so these are examples in the pictures of whole plant foods. And the reason I picked those to put in the photographs is refined foods and animal foods increase inflammation to a point that's can be harmful. So we want more of this and less of the animal. And we'll talk more about other reasons to do that with your diet at the end. The next thing I want to say something about is rest. So there are studies on people that were restricted to only about 3 or 4 hours of sleep a night and people who were given 7 to 9 hours a night. And for some reason, these subjects allowed the people doing the study to shoot cold viruses up their noses. And the ones who got enough sleep were 4 times as resistant to getting a cold. So sleep matters. So that means we need to do things to try to protect our sleep. Go to bed on time. Don't watch TV in bed or else your brain doesn't know what the bed is for. Don't use your electronic devices in bed because the light turns off your melatonin. And if you have to use it at night, like to answer texts, then make it that your phone turns amber every evening around 7. That helps. And I think most importantly, manage the amount of news that you consume, and don't do it in the evening. You're not a first responder, so you don't need to do it in the evening. And then, so that's fitness, nutrition, and rest. And then the next thing I'll mention is serenity. And that sounds very fluffy, but there is very strong evidence that when you do relaxing things, it lowers your cortisol. And if you have too much cortisol, you have too much inflammation. So it's actually been studied. It's not just a fluffy thing. So things I would mention that you should think about: enjoy everything you do, your cup of tea in the morning, your morning walk, do yoga or Tai Chi or yoga nidra. Zoom with your friends because being connected lowers your stress. Learn new things, listen to soothing music. There's another study that I saw on Nutrition Facts where they had a bunch of people listen to Mozart, and those people had lower measurements of their stress hormones. And they had other people listen to Beethoven, who is classic, but a little crazy. And those people did not drop their stress hormones. So it really does make a measurable difference. So then I will pass it over to Dr. Mansfield.
So I'd like to talk something that's probably near and dear to all of us over the last many months, and that's actually hand washing. So I actually had a young gentleman in the office today, and we were doing a physical exam, and I said, "Oh, you have COVID hands," because he had the very classic kind of the glove demarcation of the bright pink, kind of the chapped hands. And I'm like, "Oh, you're so good. You're doing such good hand care." So anyways, things that we know. So certainly being very diligent with our hand washing, the good old rule of at least 20 seconds just really ensures that we're getting that bacteria, viruses, all bad things to kind of slip off our skin. And then certainly to follow, I think there'll be a big increase in stock in Aquaphor and Cetaphil and so forth, because we all are just, our hands are just getting a lot more sanitation probably than previously, maybe. And then wiping down things that you're bringing home. So this is a really good picture of Mike, due diligence in wiping down, groceries. I know some people are leaving mail out to sit for a couple of days if it's not anything urgent. Certainly if stuff is perishable, we can't really leave it outside for a day or so, but maybe tucking it away and just, leaving it be for 1 to 2 days, and just really taking that extra precautions. Physical distancing is another really big important part of this. And so we kind of have this current standard where we think, okay, the 6 feet apart, which basically equates to about approximately 2 arms lengths. And that's good, but really that should be a minimum, because in reality, physical distancing is a bit more involved, and it's a bit more complicated than just the basic 6 feet, because there is a continuum of droplet sizes, and how we exhale our air can basically shape the range that the droplets can travel. So if there's a very low, quiet conversation versus somebody laughing, coughing, sneezing. So I would say 6 feet is kind of a minimum, so the 2 arms lengths, but that's why, because particles can travel further. And so we just want to be very aware of that.
Okay, then I'll just touch on masks. So masks are not magic, but they do make a big difference. So in this picture, the four of us are wearing masks that protect other people from us. They do not protect us. So these are the masks that surgeons have worn in the operating room for probably 80 years. And there's very clear evidence that if I wear a mask, my germs do not spread to other people. I cannot blow out a candle if I'm wearing a 2-layer cotton mask. You should try not to use synthetic unless it has a filter, because cotton has tiny little fibers that cross with each other and hold the aerosol in. I have a lot of jokes about anti-masking because it's very clear science. So there's just no question that it keeps me from spreading germs. I will say, however, that if I wear a mask and I touch it a lot, and then I touch everything around me, I am putting my germs on the things around me. So you should try very hard not to touch your mask except by the ear loops. That's all.
I love that slide, by the way.
This is what happens at the end of the day. The mask that Cindy's wearing in this picture is a mask to protect Cindy. It's an N95. And she's not wearing it correctly because at the end of the day, we're all a little flustered. But when we're really going out to the parking lot to see people who might have COVID, then we need a mask that protects the wearer. And that is an N95 mask. Okay, that's all I have to say about that. Shana?
So certainly, you know, and I think a majority of us have been doing this hopefully since about March, but staying home when possible. And just this kind of breaks it down into how risky certain activities are. You know, if we do need to go out, if there are things that are essential that we really need to do, common sense. So try to go at a less crowded time of the day. Try to choose activities that are going to have a very low number of other individuals. Certainly, I know Zoom and Doxy and all of these things have really just taken off, you know, and trying to avoid too much interaction. Trying to limit it to really kind of essential activities, things that you really need to be doing. Making sure that you have your masks, your gloves, your hand sanitizer, and just really try to be aware of that personal safety bubble. Do you have anything that you want to add to that, May?
I guess I would just remind people there's a few things that lower your risk. So the fewer times that you get exposed to the virus, the better. So don't go to 3 stores in the same day. And then when you are out, the fewer of the germ you get, the more likely you can fight it. So the less people you're around, the better you can fight it. So this is a really nice little visual, and I did post it on Facebook, but there are a few of these out, so you can, if you're not sure, you can look at this little color wheel of horror and decide what you're comfortable doing. I want to talk a little bit about making indoor environments safer. So my husband, Mike, did a little bit about airflow. And I'll go through this quickly, but the summary of this is, if we can wait this out, there are so many people out there figuring things out. They're not just figuring out how not to get this and how to treat it. They're figuring out what to do in buildings to make the airflow better so that germs are dispersed better. So more outdoor air coming inside, having the air circulate more frequently than they used to. Having the circulation start 2 hours before people go into a building, and having the circulation keep going for 2 hours after they leave the building so that it can be clean for the next day. They're also talking about different kinds of filters that work better in the air system, and using ultraviolet to kill germs. And there are lots of engineers working on this more rigorously than they used to, so we should have faith in them. I asked my son to look up architecture because people are making changes in how they design buildings. So for example, This is an office that's designed for collaboration, but not having people too close together. So every circle carpet under a desk is a 6 feet radius. So that helps because people don't judge distance well. They're arranging and teaching people to leave in a certain clockwise order so they don't cross paths. They're putting replaceable tops on desks that are used by more than one person. There's also work on making touch-free thermostats in doors and hotel doors, and the ability to purchase things with your phone without touching other people's stuff, which some of you do at the grocery store. People who make big venues like stadiums are working on more places to wash your hands, more places to sanitize, buying things with your phone, bathrooms where the surfaces are something like copper that kills germs, self-cleaning toilets and sinks like those airport toilet seats with that plastic thing that comes out and then you flush and it goes away. I think that's still super fascinating. Some of the designers are just talking about like implementing different, like instead of checking for weapons only, when people go in, check for fevers. Let's see. Some cities, like New York City, is closing some streets or sides of streets so people can eat outdoors. Some cities are making some of their streets into kind of like parks so the parks won't be too crowded. Some places are making bigger bike lanes so you can go out and exercise more easily. Because we're gonna need to make changes because we just talked about 4 pandemics in the last 102 years. So we need to make some changes so we can live better. This is an example of a park someone's designing so more people can be in it and enjoy nature but not breathe on each other. Hospitals are working on having fewer horizontal surfaces for the germs to land on and modifying the patient rooms so they're safer. And just lots of little, and making nooks in the waiting room so that you can go with your family but not breathe on the next family, because that's another horrifying thing that's happening now is people go to the hospital and their family's at home and doesn't know how it's going. So. In houses, architects are making ways for people to work from home more comfortably. So movable walls, acoustic movable surfaces, plans that give you privacy. Like there are days when all 4 of us are here working and it's kind of bizarre. And I apologize sometimes to my patients for the weird stuff that they're hearing from every other room. They're also working on ways to give people more chances to take a mental break. So gardens and rooftop gardens and balconies and terraces. So lots of ways for people to work more from home and not go crazy. So that is Dr. Mansfield again.
Yeah, I was going to actually talk about vaccinations because of course we're all kind of chomping at the bit. So there are trials underway for COVID vaccination. It's actually between the FDA and the National Institutes of Health. So the phase 3 trials are underway, which means that they'll actually start, trying it on humans. But as per the FDA, it's probably a good 12 months out, realistically, before we'll see something. But it's anticipated that it's going to be a 2-shot series that are administered about 3 weeks apart. So again, hopefully sooner than a year, but that's probably more of a realistic expectation. I do want to touch on flu vaccine, especially this year. So, we're kind of all in this together and we've never done this before. We've never had COVID plus influenza. So a bit of an unknown. And so really, if there's any time to really advocate for getting a flu shot. I know that there are some people that, that's not their thing. They prefer to not get a flu shot. And I'm usually very respectful of that. But this year, I think I might be changing my tune a bit because I just can't advocate enough how important it is to use all of the resources we have to keep us safe. Traditionally, Dr. Diedrich and I have just the very standard quadrivalent flu vaccine available, which usually is just fine. But we had actually recently been talking about looking at the high dose influenza vaccine. So typically it's indicated for persons that are 65 years or older that have potentially multiple health issues that they're dealing with. And it's actually, the high dose flu shot has 4 times the antigen, which means that it's trying to kind of rev up your immune system to have a stronger response. And it's about between 24 to 30% more effective than the traditional flu shot, but it's like every year because the viral strains change, and so it is a bit of a moving target. It's not an exact number that we'll see every year. But we do see a decrease in hospitalizations and a decrease in mortality in relation to post-influenza complications. So again, that's something that Dr. Diedrich and I are looking at having in the office, just in light of as flu season approaches, and we just want to use all the resources that we have and be prepared, because we're all kind of going into this for the first time together. Anything you want to add to that, May?
I would say also tetanus boosters, because they have pertussis or whooping cough in the vaccine. And Arizona has whooping cough again, and that would be a really bad thing. It would make your lungs really susceptible if you had that.
And probably the pneumococcal, making sure those are up to date as well.
So those are things we talk about at everybody's annual physical. We run through that, and that's why we're bothering you with the same questions every year, just to be sure.
So we're just reminding everybody, especially this fall season,
to do a good job. Okay, I want to talk just a tiny bit more about preventing complications. So preventive health care is really important. And so one of the things that we know about any viral lung infection is if you get any lung infection viral, for the next 7 days, you are 6 times as likely to have a heart attack as your baseline. So that's really a big deal. So our patients, which I think almost everybody on here is one of our patients, will recognize this picture. So in the ICU, so Dr. Mansfield and I had a Zoom meeting like in April when ICU doctors had been seeing people for about a month, maybe it was June, and they said there are 3 tests that we are doing on our ICU patients to make sure that they are not at super high risk for a clot, because 1/3 to 1/2 of the deaths are from clots. So we're testing 3 of these chemicals that you can see on the top of this picture, and all of you have seen this at your physical. Those chemicals tell if you are more likely to clot. Well, we're not waiting till you're in the ICU. We're recommending and doing on you, and you should tell your friends, get them tested ahead of time, and then do something about them if they're high, so that you are not likely for something bad to happen if you get COVID. So that's all I have to say about that. Okay, Dr. Mansfield.
So I was going to touch a little bit on testing. So I know there's a lot of information kind of circulating and what's accurate, what's not accurate. So just a couple of general topics. If somebody is known to have antibodies, if you test positive for COVID antibodies, we're doing the testing in the office. So what does that mean? Can I get sick again? Am I completely protected? And for how long? And these actually, a lot of this is information that we just don't have yet. So if you have an antibody to COVID, whether you've had an illness or not, we do think that that gives you an immune protection, but we don't know for how long. And so we were recently on an immunology infectious disease call, about a month ago? And the evidence is showing that 70% of people are actually losing antibody protection after about 3 months. So if you test positive for antibodies, that tells us that either you had an infection or that you were at least exposed, but that doesn't mean that you're totally protected from getting it again. Again, this is kind of a moving target, and so we just don't have a long enough amount of information to know that for sure. If you find, just in all of our limited social settings at this point, if you are exposed to somebody that has COVID, if you remain symptom-free for 14 days, meaning you have no upper respiratory symptoms, so you have no fever, no runny nose, no cough, you're symptom-free, we suggest that you get an antibody test at about day 14. If we check too soon, we might get a false negative result. If you are exposed to somebody with COVID and you do in fact start developing upper respiratory symptoms, then we're going to actually want to, and we can do it in the office, but we would want to do the nasopharyngeal swab. Typically, it used to be between day 2 and 5, and now we think it might be between 2 and 8. So roughly day 5, we think we're going to get the best viral sampling to give us an accurate result. The test for the actual disease itself, so if you have the COVID virus, that is going to be your antigen test. And we're definitely doing as best as we can in kind of putting all of this testing out quite quickly. But with the disease test, it can still have a false negative rate of about 20 to 30%. So if I have somebody that has flu-like symptoms, we think, oh gosh, they've got COVID, and we do the viral test on them or the nasal swab, and it's negative, there's still a 20 to a 30% chance that they could actually still have COVID. So it's a good test, but it's not perfect, so we still proceed with caution. The antibody test, which again is telling us if you've either been exposed or if you have the disease, is a very sensitive and specific test. So I think it's between 96 and 98%. So it's really an accurate test. One of the things that I've kind of found though, and Dr. Diedrich can chime in as well, is that I've had probably a small handful of patients that have been so sick, and checked them for influenza and it was negative, but their antigen and antibody tests were both negative. And so it is still a possibility for anything, not just COVID, for flu, for lots of things. But it is possible that somebody can test negative and they may still have had it, but they just didn't mount a big enough of an immune response that we could identify it or track it on a lab test. So if you are in a situation where you need to be tested, certainly we can test you at our office. A lot of different, like CVS does testing, and there's, different, I don't know if Walgreens is still doing testing. They may have like, they were doing like testing blitzes, I think, through the county health department. So there's lots of facilities where you should be able to get tested, but we are doing testing in our office, just so you know.
I would add one thing, just to reassure people, we don't test inside the office. We do what Dr. Mansfield's doing in this picture, and that was in the very beginning of the pandemic. Now we also wear hair nets. We look like the lunch lady. We are very protected, and we don't bring anyone who could have any remote symptoms inside. Even though we clean all the time, we don't bring sick people inside.
We have not had a febrile patient. So we've not had a patient with a fever in the office since beginning of March.
Yeah.
End of February. So it's very refreshing going outside in the lunch lady outfit doing the swabs. So anyways, so we're doing testing for both antigen, antibody. So if there's a concern, if there's a worry, if you think you may have been exposed, the first thing that you should do is just give us a call and we'll direct you and we'll make a good decision. Antibody treatments, did you have anything else you wanted to add, May?
I think you got it.
Okay, so antibody treatments, so that again is something that is definitely under clinical trials. So I've had a few patients that have actually had COVID and they're recovered and they think, well, shoot, what do? I want to donate my blood. I want to do something so that I can try to pass along my antibodies to help people. And so that, again, is still under clinical trials, so through the National Institute of Health. So again, a lot of this is up and running, but it's just not out for mass distribution yet. There has been, probably most of you are familiar with, there's been questions about, you know, gosh, if I'm exposed, you know, I want to get a Z-Pak and I want to get Plaquenil and I want to get some of these things to help me prevent. Again, there's just not enough data to support that that is helpful. Remdesivir is an antiviral medication that's one of the newer HIV medications. And what they found years ago, there were some very similar but older HIV medications that were effective against SARS and MERS, if you remember those historically, but they were effective against those things in a Petri dish. So again, there's hope with a lot of this, but we just don't know for sure. I do know that when patients are hospitalized with COVID, there's kind of a cocktail that they're getting, and we're typically giving steroids. Dr. Diedrich mentioned the huge increase in risk of clotting, so patients are placed on a blood thinner just to help to prevent the clotting. And then there's a different rheumatoid medication that's being thought about for use, but again, we don't know for sure. So there are definitely things that are being tried and we're using and just trying to see where we're making headway. And a lot of this that we're doing, we're trying to prevent the clotting and then that whole inflammation storm that happens where your immune system kind of goes into overdrive.
I would just comment on the first two meds that most people here knew about was the Zithromax antibiotic and the Plaquenil. And now we realize that we should not jump into anything that someone else says might work, because those two drugs change your heart rhythm and make you more susceptible to fatal arrhythmias. So we're not doing that anymore. Right. And I think they're being a little more careful. So sometimes in the media, you'll hear outraged people saying, why are we not trying all these meds? Because it's not safe to just try stuff randomly.
Right. Yeah. So I think, you know, we're trying and we're looking for things, but again, something that's been tried and true and safe, because, you know, there's always risk versus benefit. So probably the main two tried and true are the blood thinners and then the steroids, which, you know, that's a usual protocol. So May, did you want me to go through the remainder of this?
Let's do that quickly and just give people a general idea.
Okay. So life after COVID. So somebody's exposed, maybe they test positive, they develop symptoms. We believe that people are most contagious for about 2 days before you develop symptoms. So when we talk, you know, when people say, well, gosh, I don't feel bad, I feel fine. I mean, I don't need to wash my hands, I don't need to wear a mask, I don't need to do any of this. And it's like, what people don't realize is they can be asymptomatic carriers, which also kind of ties back into, you know, kiddos going back to school. So, you know, their kids are so much less likely to have serious sequelae, but yet they can be transmitters. So because we are really contagious before we even know that we're sick. So most contagious for about 2 days before you develop symptoms. You can remain contagious for about 10 days in a mild case, up to 20 days in severe cases. So this is kind of why we have this rough, like 14-day time frame. There's actually been some studies with hospitalized patients. They were actively secreting, their secretions were positive for COVID up to 6 weeks after being in the hospital. So again, it's again, there's kind of some general ideas, but quite a bit of variation. 87% of hospitalized COVID patients still had symptoms about 2 months after diagnosis. So the fatigue, the difficulty breathing, the joint pain, muscle pain, chest pain. So, you know, that's, you know, it definitely can be a slippery slope and a very prolonged thing. So if you are sick, if you develop symptoms, best things that you can do, self-isolate, avoid contact, use your own towels and dishes and restrooms, and just try to really kind of stay clear, because you want to protect those around you. I've actually had a couple of families that have tested positive, where one person in the family was positive. They just kind of hid in a separate bedroom, literally for like the 14 days, took all precautions, and the rest of the family didn't get sick and tested negative. So it is possible to do that.
Or got less sick.
Or got less sick, true.
Where they isolated as soon as they figured it out, and the other people got it, but not as bad.
Yeah. How would you know if it was time to go to the hospital? So obviously, any concerns or questions, please call us right away. As far as when would you go to the hospital, in my opinion, it's any sort of an acute symptom that can't wait. So shortness of breath, chest pain, dizziness, inability to stand, intractable pain. So anytime that you have any sort of a symptom that you can't manage with rest, hydration, Tylenol, Motrin, that would be time to basically call 911 or go to the hospital, which hopefully none of you are dealing with. And as far as, I think I already touched on this a little bit, but as far as, reinfection and antibody levels, we don't yet know, if you've had it once, can you get it again? Maybe, because again, we're seeing that people are losing their antibody levels within a couple of months. So this is stuff that we're probably going to have to hang tight and just see how this plays out. The more information that we gain and kind of see how things follow through, and we'll have more information. We just don't have enough information yet.
Okay, so I'm going to talk about hopeful things. How do we prevent future pandemics? We do have some control over this. So I'll mention two things that we can do. They're really the same thing, but for two reasons they help. Make choices that are good for the environment. Use less water. And a real big way we can do this is to eat foods that require less water to produce. So if you do that, we won't deplete the water that the wildlife need, and they won't have to encroach on our towns and cities and share their germs with us. That's one. Number two, eat more whole plant foods. I know that I'm a broken record. However, every time when we raise enough animals to eat meat or eggs or cheese 3 times a day, then we have to raise the animals right on top of each other. And we have to make them grow rapidly. So today, a cow grows to edible size in 1/4 of the natural time. And we do it through science with antibiotics and hormones. But those antibiotics and hormones make the animals mutate their genes more rapidly. So now they live this close to each other, they share germs with each other, they mutate germs and then share them. And those are the germs that people get from animals that started at least the last 3 pandemics. We have really good evidence of that. So if we make choices that will use less water and require the growth of fewer animals, it doesn't mean give up those foods, but fewer meals containing those foods, we will really reduce the chance of another pandemic, because they're happening on average about 25 years apart. Okay, Gata.
So again, to try to end on a positive note, so there are some things in this time where it kind of feels like things are a little bit crazy and a little bit overwhelming. There are things absolutely that we have control over. So you can reduce your chances of getting COVID. You can reduce your chance of spreading it, and how likely we are to have more pandemics. And I think that that's, and I'm not vegan, I'm more of a vegetarian, but I just, learning some of this information from Dr. Diedrich, that really we see a lot of these viruses and pandemics, and it just comes from the poor practices of, farming and animals and mass producing. And it's a little bit scary to think about that stuff. So there are many things that we have control over and doing the right things to take care of ourselves. And
Right.
it's okay. We haven't completely lost control.
Right. So I would like to say, lastly, make personal choices every day that lower your own risk. Make the future for yourself that you want for yourself, and make choices that are good for the environment because they are good for all of us. So I'm going to make this presentation picture go away, I think. And I want to go back. Am I still sharing?
Mm-hmm.
Okay, I don't want to share, so let me move that. Stop sharing. And I want to go back to, I think I need my son to come back. Are we back to our pictures?
No.
Not yet.
I need Sam. Let me find Sam. Group picture.
Dr. Dietrich, usually at the top of your
I
screen.
need my son and he can't hear me. I excused him. Hold on.
Oh, sorry, Penny. Thank you.
I stopped sharing, but now I want to bring it back to just the, I just want to have us on the screen, not the stuff. Stop share. How's that? Is that better?
It's better.
Okay, I'm going to unmute everybody and then see if people have questions. And Judith, you might need to help us pay attention to who has questions. So I just unmuted. Does anybody have a question they want us to address? Let's see, Jan, you want to be first?
Okay, I have two questions, but I can just do one at a time if you want. You're talking about masks, and you said something about cotton masks, and I couldn't tell if you meant they were good or bad.
Oh, cotton is good because cotton fibers have little fuzzies on them that when the fibers are overlapped, they kind of keep all the aerosol in the mask. So they're good. And there is one thing I forgot to say. Not everyone can get their hands on N95s. Like we are having trouble getting enough for ourselves. But if you get a 2-ply cotton mask and put a little hole on the inner one and put a coffee filter inside, it's almost the same as an N95.
Oh.
The other thing too, I want to mention, so when you think about the entire world wearing masks too, if you have cotton masks that you can wash, just so much better for the environment than massive, dumping of disposable masks every which way. So if that's something that people can do, that's obviously ideal.
Okay, and also, oh, Noel, I think you're muted.
So we're supposed to get disposable masks? Is that what you said?
Say that again. Should we get disposable masks? Was that the
Disposable is good?
you can use disposable masks if you can get them, but those are even a little hard to get.
The cotton ones are okay. The ones we washed, that's good.
Yes.
What you were saying. I think she didn't get that that was good.
Okay. Yes, it is good because we're trying to reduce mass quantities of waste and yeah.
I'm going to unmute Noel because I see Noel having a question, but you're muted, Noel.
Busy day all of a sudden.
Ask to unmute. Yeah, can you unmute
I
yourself?
got it. I
There you
got it. My question is this. When will you have the flu shots in?
They are arriving the first part of September.
Okay.
So we will send out a mass email or voice shot letting people know when they're actually.
Great. Thank you.
Mm-hmm.
Edie?
Okay, I had that question, but also you talked about gloves, and early on people talked about wearing gloves, and sometimes when I go to the vegetable market, they make me wear gloves. But what do you recommend for gloves? I mean, do you recommend we wear gloves whenever we go out, or just come in and wash our hands?
Let me take that one, and then I can see my sister-in-law who's an epidemiologist on camera, so she'll correct me if it's not up to date. Gloves in and of themselves don't do anything special, because if you touch the germ with your gloved hands and touch your face, it's like you're not wearing gloves. I think that some markets are giving them to us so that the germs that are already on our hands won't get on their produce, but they make people have a false sense of security, I think. So I don't wear them except when I am touching a sick patient. But maybe, Beth, do you have anything you want to say about that? You guys are muted. Hold on a second. Can I take your temperature?
Hi, everybody. I'm Beth. I'm an epidemiologist. I am not an infectious disease epidemiologist, but I deal with chronic disease epidemiology, but I do follow this information. Yeah, I would not recommend generally wearing gloves because I agree with Dr. Diedrich that it's, it will give you a false sense of security and you'll end up touching things too much. So I think just keeping an eye on washing your hands or using the alcohol gel if you don't have access to wash your hands right at that moment.
Thank you. Who else has a question?
Yeah.
Catherine?
See me.
Oh, you're muted, Catherine.
On the bottom left, probably.
You were talking about disinfecting. When it first happened, I know we were all disinfecting everything, or I was, and then I thought we got the information that that wasn't doing much good, and that it was mainly.
Ready? We got it all cleaned off.
Can you hear me?
I can hear you, yeah. So I'll say what I think, and then Shayna, you can jump in too. I think that it is much less.
My computer in the car. It's too hot out there.
It is much less likely to get the infection from touching your groceries, but it's not zero. So what we do, because we don't want to waste a lot of wipes, is we put 1/4 teaspoon of Clorox in 1/4 cup of water, and we use a cloth to wipe our groceries, just to be thorough, just to reduce our risk. Shayna, do you have anything you would add?
Yeah, I mean, and the same, you know, a lot of this is kind of a moving target. So yeah, initially we were doing that with everything, and now we're doing it a little bit less. And the same thing, we're kind of doing a diluted Clorox, but probably not as strictly as we were, say, back in, you know, March or April. But I think, you know, just in general, the general precautions, right? Things to be aware of.
Yeah, I think the biggest transmission is people not wearing masks, or people wearing masks and touching them and touching other things as if the mask was helping, and that the germs, their germs are in their mask. So those are the biggest. How about Patty?
Oh, thank you. So I have a couple of questions. The 87% that had symptoms 2 months after, were those hospitalized patients, or were they just patients in general that had been diagnosed with COVID?
Hospitalized patients.
Hospitalized patients.
Okay, so hospitalized. Okay,
right.
I missed that part. And then my second question is about the mask. Oh, is it okay? Can you
Go ahead.
The mask wearing, right? So it just, I just hope for an explanation about this. From the beginning, when they were like, people don't need to wear a mask, I was like, I don't know about that. Then it was wearing masks, and I have a hard time wrapping my head around how a mask that I wear only protects someone else and not myself. Like, and sometimes I will even double mask. Does that make sense? You know, like if I'm going some places, I might put 2 masks on, and I'm thinking surely I'm getting some kind of protection, because I live in an apartment sort of complex area, and anytime I walk out, a lot of younger people in their 20s, they're not wearing masks doing anything. I'm masking up, and I'm like, surely I'm getting some benefit out of that, because I think to try to appeal to other people that wearing a mask protects other people is a big assumption about the population in the United States, and maybe more people would mask if the medical professionals were like, wearing a mask protects you, right? Not everybody else, because nobody cares about everybody else these days. I mean, I don't know. Help me understand that.
So I would say, and Beth can say if they have something else, there is a little bit of protection to you. However, if I put on a mask and cough COVID into my face without a mask, it will be on my mask. So it's a little better than not having one, but it's not very good unless I have a coffee filter in it so the germs out of the inside of the mask.
So what if you had like a cotton mask and you did a surgical in addition with that? And aren't surgicals made where one side is sort of hydrophobic and stuff? So I always think, isn't that kind of designed so that I'm not getting pelted with virus droplets or aerosols, or is that crazy? I mean, I just don't understand that.
Dr. Mansfield, do you have any knowledge on this?
Getting an echo.
Yeah, May, I can't hear you very well. There's lots of like background noise.
We need to mute everybody except for the person asking the question so we can hear better.
Okay.
And then mute all. And then let me unmute Dr. Mansfield. Okay, so Dr. Mansfield.
Sorry, I couldn't hear what you were saying previously.
I was saying I have not read studies to figure out how much gets through regular masks, if it's double mask or surgical mask. I don't know the answer.
Yeah, I don't know the difference. I mean, I know basically like viral size, and like you were saying, the cotton mask is usually sufficient with the way that it's woven from the 0.3 to 1, I think microns is the size. I don't know the difference though between like a cloth mask or a cotton mask versus say a surgical mask.
Yeah, I would say if I want to go in a dangerous place and I do not have an N95, I would buy a bag of coffee filters and I would put one inside whenever I want to go in a risky place. That's my answer, and I'm sticking to it. Mr. Brandling, you kept trying. Did we answer your question?
No. Dr. Mansfield, you mentioned a test that had a high accuracy, I think up in the 90%. Would you repeat what that was for?
Sure. So it's for the COVID antibody. So when we do a test, there's typically two tests. So one is looking for the antigen, which is the actual disease. And then one is for the antibody to see if your body has mounted a response against it. So the antibody test, which is typically done by a blood draw, has a really high sensitivity and specificity, which means basically that it's very accurate. But that's for the antibody.
All right, thank you.
Sure.
I want to comment on one of the viewers who's turned off her picture now and might have even, did you leave, Pamela? I don't see you anymore. She was using her treadmill while listening to this. I was very impressed.
Penny has a question.
Yes, go ahead, Penny.
So I believe you had said that, oh, I'm muted. Unmute.
Oh. Sorry, that was me just being deaf.
Oh, she's muted again.
Okay, did we do it at the same time?
There we go.
Thank you. By the way, very good information. Thank you so much for sharing. I believe you had said that you conduct tests for COVID in your office. And just wondering how long it takes to get the results from that.
2 to 5 days. It depends on the lab, how swamped they are. But you know, since the numbers dropped in Arizona, I've been getting some results the very next day. Yeah. I did one yesterday and I got it today because our numbers are improved. So the lab is not so swamped.
Good. Thank you.
Yeah, our longest wait time was 11 days and the patient was better by then.
Yeah.
So, but yeah, it's better. The labs I don't think are as inundated.
Okay, that's great. Thank you.
I might be able to send you you all some information that you could put in your email, because that's an easier thing to do. But so some of the reason why there was difficulty with science communication at the beginning of the pandemic is that you know, scientists really want really strong and good evidence to make a recommendation, and there wasn't a consensus about really good strong information about this at the beginning of things, and it took a little while to get that evidence. But that evidence does exist. There are studies that show that wearing masks and wearing face covering does reduce the spread. If everybody had access to an N95, which was the picture that that May and Shana showed of Cindy wearing that special mask, we all had access to that kind of mask. That would be the best mask to wear. But what we want to do is we want to save those masks for the health professionals who need them, because there's a shortage. And so the next best thing you can do is wear these the cotton 2-ply masks, and it does protect others. And I do think the science will start to be coming around to what was being discussed earlier about whether it does also protect you, because it seems, again, I agree, logically, like it would protect you. We just don't have good evidence about that yet, and I'm sure people are looking into it.
So are they getting that from just the random internet, probably?
Yes, there's a lot of misinformation and conspiracy theories going around that propagate very rapidly on the internet, and it's very, very difficult to stay out ahead of them. And then when they get repeated on a television station that has a big reach, then that's what happens. And there's no good evidence to support people saying that masks don't work.
So just to reiterate what Beth just said, scientists want strong evidence first. They are not dragging their feet because they want to make money off something or they have a secret. They are dragging their feet because they want to do no harm, like the harm that was done by giving Zithromax and Plaquenil and throwing people into heart arrhythmias that kill them. We don't want to do bad things just because we're in a hurry to do something.
Can I just add one little comment? The other thing is, if you read not as a scientist, but as a social scientist, the countries where they're wearing masks have done a better job of containing the virus, and over and over and over again. So there's also that evidence, I think.
Yeah. And then I think now I do see Pamela. Pamela, I want to applaud you in front of everybody because you're my hero right now.
Thank you. I do have one quick question to touch on. If you had the virus, you may have an immunity for, we were saying 3 months possibly?
We're not positive, but yes.
Yeah. Sorry, go ahead, May.
Well, we're not sure how long you have immunity, and still, even if you have immunity, can you withstand a small dose of the virus, or can you walk up to someone with COVID and let them cough on you without a mask and be okay? There's a lot of questions not yet answered.
Okay. So it's a possibility that you could possibly contract it again.
Yes, and in fact, one of my patients just got out of the ICU with COVID, and she was very, very sick in February. I sent her to the hospital, and I wasn't thinking of COVID, and neither were they, and no one ever figured out what was wrong with her, but she had the type of x-ray findings that people with COVID had. She got almost back to her normal, and then she got very sick about 3 weeks ago, and this was COVID. And how we knew to send her to the hospital, besides being short of breath and chest hurts, it felt exactly like February. So she may have had it twice.
Thank you.
Kathy?
I have a quick question. I'm hearing that eye shields, glasses, goggles, face shields help too. Since I work with children, I was wondering, do I need the mask and the eye shields and a shield over to continue? What's the best solution to that problem?
Give that to Dr. Mansfield, because one of her close friends is a Banner Hospital doctor, and they rotate through the COVID wards. So what do you know? Has Adrienne talked about this?
No, I mean, it's, you know, some of the docs that I know that are actually in the hospital and they're doing this, so they're kind of already with known COVID persons. So obviously they're doing PPE, you know, but it's, I don't know the answer to that question as far as, I mean, because if you think about, you know, if you're wearing glasses anyways, and I don't know, maybe Beth knows the answer to this, but even if you're doing safety goggles, you know, technically the viral particles can still get around and get, you know, so I don't know.
The direct stuff that happens when kids are coughing or laughing or yelling. So I'm sure it helps some, but I don't know where to look up the degree of reduction in infection.
Yeah.
I can try.
I don't have an answer to that. I'm sorry.
That's all right.
Thank you. As well when I look that up. But I do think that, you know, I think a helpful way to think about these things is what's the risk and benefit balance. And that's a lot about what, you know, Doctors Diedrich and Mansfield have been talking about tonight. It's what doctors and public health professionals do all the time. How do you help the most and hurt the least? And so in your case, if it doesn't bother you, you know, then go ahead and wear the face shield and the mask, and there's nothing that's going to be harmful to you about that, and it may be beneficial. And this is another area where there's active research going on about numbers, right? Like how much does it reduce your risk? I don't think we have good numbers about that, but that's research that's ongoing.
Good. Any other questions? I can only see part of the screen at a time, but anyone have anything else, or do you want to, oh, I think Jan might have one.
I'm not sure, this might be a little bit off topic, but I've never been to an emergency room in my life, never gone to a hospital with some kind of emergency. And I wonder if there's some way I could know ahead of time in case I can't get a hold of, you know, you guys are sleeping or something. And how do I find out which one I call, or do I just, and is that going to be the one that has my insurance? And is there a way I can check that first?
Emergency rooms have to treat all comers.
But I guess there's the insurance problem where you later on you get this $20,000 bill and because you went to the wrong hospital.
I don't think that applies to ER visits anymore. Judith, so there. Let's see
what you can do is call your insurance company, the customer service rep, and ask them if there is a specific hospital that they're contracted with. But emergency rooms are required to treat you no matter what, if you have insurance or don't have insurance. So that, yeah, I'd call them just to kind of get a feel. If you do call 911, they take you to whatever hospital is the closest.
Closest, yeah.
Okay.
Well, I think I'm going to say we'll call it so people can eat dinner. But I'm really tickled at how many of you showed up for this. It's really nice to see everyone's face.
Yes, I like seeing everybody.
Thank you to my family for showing up, my sister, my brother. I think my mom is done for the day because they're on the East Coast, but tell her thank you.
Thank you, Beth.
Thank you both.
I'll have a beautiful evening, and we'll send the recording if you want it.
Thank you very much.
Thank you, doctors.
Take care.
Bye.
Bye. Thank you so much. Thank you so much.
Thank you.
Thank you, doctors.
Bye.